So thank you for joining us for the Atlas CareMap workshop. Hopefully you would have attended the webinar that we had in mid-February that really talked about the PIMS Care Connection program and specifically started to talk about this tool a little bit. So in this workshop, we're going to dive right in. And just want to mention that we're actually co-hosting this with Compassionate Communities Kingston, Canada. So that is a Compassionate Communities movement in the Kingston area in Ontario. So thank you for joining us. I also just wanted to take a moment before we started to acknowledge the land that I'm presenting on today, which is the city of Ottawa, and is traditionally an unceded territory of the Algonquin Anishinaabeg people. I would also like to acknowledge the land I was born on, which is the unceded territory of the Wabanaki people in New Brunswick. Cynthia?
Yes, I'd like to begin by respectfully acknowledging that I'm meeting you all on the traditional lands of the Anishinaabe and the Haudenosaunee, and thank these nations for the care and stewardship over these shared lands. We honor the lands of the First Nations and the Métis who have lived, traveled, and gathered here for thousands of years. It is in their footsteps that we've marked the land before us. In the work we do today, we should be thoughtful and do our best to act in the spirit of reconciliation, learning to work together to provide better care for these communities.
Thank you. Before we get started, just a few housekeeping things. So we want to thank Health Canada as they have been kind enough to help us develop and support the Palliative Care Echo project, as well as the Atlas CareMap project. So thank you, Health Canada, for the support on that. And the Palliative Care Echo project, just a little bit about it. It's a 5-year national initiative to cultivate communities of practice and establish continuous professional development among healthcare providers across Canada. So there's our shout out for the thank you to Health Canada. I also want to take a moment to acknowledge Atlas of Caregiving. So the Atlas CareMap tool was created by Atlas of Caregiving. And so they've been great at working with us to basically share that resource in Canada and make adjustments to the content and even develop new pieces where it made sense in Canada. So we really want to thank them for working so closely with us and allowing us to share this really great resource. Just quickly, some introductions. So I'll be your host today. And my name is Bonnie Tompkins. I'm the Compassionate Communities National Lead at PIME Canada. The focus of my work is around communities. And our presenter today will be Cynthia Beach, and she's a board member of Compassionate Communities Kingston, Canada. So thank you, Cynthia, for being with us today. Just want to do a few little reminders. So feel free to introduce yourself in the chat. Your microphone is muted, but there will be times where, there may be an option to unmute, for instance, if we're doing questions and discussions, because there are some activities in here. You are also welcome to use the chat function, as mentioned, ask questions, comment. Also, if you need any tech support, there are 2 PIM staff on here who they will help us out with any tech issues, which is a wonderful thing to know that we have available to us. When we are doing an activity later on, you ideally will need to not have a Zoom background on. So for instance, say if you have one of the backgrounds where it's blurry, because it will make it hard to run the activity. So if you need any help with that, again, the ladies who are on to help us with tech support will be able to help. And just also to remind you that this session is recorded and will be emailed to everybody next week. So if something happens and you have to leave early and you miss something, you will get that recording. And just remember not to disclose any personal health information during the session. So just quickly, a little bit about PIAM Canada. So PIAM Canada is a national not-for-profit organization that has been building palliative care capacity since the 2000s in the community and the healthcare sector in both official languages. And basically, a lot of the work that we're doing is equipping healthcare professionals to provide palliative care in a variety of settings, equipping healthcare organizations, and then also the community as well. So those are sort of the three approaches that we're using. And really it's about building that capacity. Looking to transform practice and settings around palliative care and how it's delivered, involved in research and technology. And as mentioned, communities is a big part of PIAM's mission to ensure everybody has access to palliative care in Canada. Okay, I'm going to pass it over to Cynthia for the next few slides.
All right. Well, I want to introduce the Compassionate Communities Kingston Canada group. And I'm going to read a little bit about what we're all about. So it's a group that we know that we all want to live as well as we can for as long as we can. And Compassionate Communities Kingston's focus is to change two social norms. So the first is that we are a death-defying society, that people instinctively also decline help from personal and community networks when it's offered, and they say, thank you, I'm fine, even when they're not. The second norm is that community members want to help, but they don't always know how, and they lack the confidence in how to help. So we were established in 2017. The organization is a voluntary network of people in Kingston who are passionate about actively improving those coping with life-limiting illnesses, death, and dying. And we have a number of initiatives underway that are all driven by volunteers, and I'll just mention a couple of them. For advanced care planning, April is the planning for end of life month, and we have quite a few sessions that are set up. If anyone is interested, they're offered at the Senior Center as well. You can sign up through the Kingston Frontenac Public Library. Another one of the initiatives that we're working on is for community connectors. So we're looking at telling stories about our community members and how they're reducing social isolation and making people feel valued at their end of life. We're connecting with people from this little place called Frome in England and following a model that they've developed there. So we hope to connect people and services to activities already underway in the community that would benefit from those. And I think you're going to hear a little bit more about that model later in the presentation, but we have a small group of innovative volunteers who are working on a Made in Kingston version. So anyone who's interested in any of this and wants to find out more, please send your email to the email that's on the screen. It's in your package as well, or you can look at our website as well and sign up there. We do a monthly newsletter and you can find out more from that as well. So I'm going to go over the learning objectives for today. So if by participating in the workshop, we hope that you get a better understanding of the CareMap and its benefits to the person who's receiving the care, but also to the caregiver as well. So we will build our own CareMap and learn how to share it as well during the workshop. So to achieve the learning objectives today, the workshop will cover the following topics. In part 1, we'll cover what a CareMap is and why it's helpful. In part 2, we'll go into creating the CareMap. And after part 2, we'll have a 10 to 15 minute break where you can grab refreshments or stretch your legs. In part 3, we'll be putting our CareMap to work and sharing our CareMap with each other. And in part 4, we'll be introducing organizations and resources that help caregivers and care recipients. So I also wanted to take a minute to mention to you that if that if you have any caregiving experience, you may find some of this tough to go through. So feel free to take a break, mute, walk away, and don't forget to get the recording, and you can go back and look at it as well at any time. So I wanted to go over a quick moment just to go over the key terms and what they mean for this workshop's purpose. That way we're all on the same page. So a caregiver is a family member, a friend, a community member, providing unpaid care with daily activities to the individual with a medical condition or illness. A care recipient is the individual receiving the care. The healthcare professional is a member of the medical profession who is providing care, and that could include your doctor, your nurses, physiotherapists, pharmacists, or really anyone who's providing medical care. And your support network is the individuals that support you, whether it's physically or emotionally. We'd like to start this workshop by taking a few minutes to get everyone warmed up and get to know each other a little bit. So we've created this poll to understand why you want to learn today in the workshop, and why you wanted to create an Atlas CareMap. So please select the most appropriate, and then we can get an idea of who all is participating today.
So we have a good, looks like, Cynthia, we have a good cross-section of why people are here. So that's great. We have some healthcare professionals, people belonging to organizations. It appears some caregivers, and then 2 people who also want to support the caregivers around them personally. So that's great.
So one of the things that we want to talk about is that the research shows that in the last 12 months of a patient's life, the medical care provided to a patient adds up to about 20% of their total care. And that leaves the other 80% of care to be supported by the caregiver. So it makes sense that caregivers are feeling quite overwhelmed at times and stretched out, trying to provide that 80% of care. The question is, what if other people become involved in supporting the care, like family, friends, community services? So by attending this workshop, you're taking action to help change this. It's time to build more community capacity, leaning on each other in trying times, and reaching out to family, friends, and community services. And by the end of this, you'll all have a number of resources. So let's start by learning about the CareMap. One of the challenges of caring for others is coordinating the people and the services involved, whether by tasks or other support. And it's hard to keep clear who's doing what and understanding who else is involved and how their actions affect each other. So CareMap is a simple visual diagram of the people involved in providing care to the caregiver or the care recipient. It includes family and friends, healthcare professionals who provide assistance and support, however big or small, and having a CareMap helps coordinate and understand the support network and the various people involved in caring for someone. It helps everyone in the support network have a clear picture of the caregiving experience, better organize the tasks and activities while highlighting additional support areas. And in your welcome package, you received a document titled How to Create an Atlas CareMap. We wanted to point out that there are several links with short videos that you might find helpful in the future to have a look at about the care maps. So this is a simplified version of the care map that could include, in this household, for instance, there's Shelley and Eric who support each other as partners. They're both the primary caregivers of Joan, as she cannot do most tasks. Joan also has a doctor, Dr. Rupert, who's involved in the CareMap. And you can see that Claire takes care of Dot, the cat, and supplies emotional support for Joan. So as you're looking at this map, think about how big your care map might be. Think about the individuals that help you, even the small things. And although the difference, the difference is that these individuals will make, and they do give a lasting impact. So this support allows the caregiver to spend more quality time with their loved one and for self-care. So people are often uncomfortable asking for or accepting offers of help from family and friends, despite a clear need for support while giving care. People are willing to provide support, often don't know what to offer. And remember, people want to help and feel better when they do. They benefit from offering assistance as well. They just need a little bit of direction to help them. It's important to note that accepting help or asking for help doesn't mean that you're weak or not in control of your caregiving role or you're a burden to the people that are around you. Instead, it shows strength and that you yourself know your limits and how to use the people around you who want to help. We need as a community to shift our ideas about what's socially acceptable so that people don't feel uncomfortable when asking for or accepting help from one another. And we can't do it all on our own. All of us will probably in our lifetime be caregivers to some extent, and the burden can be lessened just by having people around you help. So the fact is you're here today shows that we're all concerned and want to improve the experience for yourself and someone who's close to you. So let's get started. And in this section, you'll be making a care map. We recommend that you make your care map by hand the first time. This approach lets you easily make changes and take notes about what is working and what isn't. So if you can please open up your care map how-to guide and the care map building questions that were emailed to you as part of your welcome package. If you can't find them, we've dropped them into the chat box as well. So please download and open the file and have them visible to you while you're creating your map. The documents together provide you with the detailed steps on how to create your care map.
And so just because we recognize everybody learns differently, we're actually going to show one of Atlas of Caregiving's short little videos around how to create a care map. So if you just bear with me for a moment. Cynthia, can you see the screen with the videos?
Yes.
Perfect. Just making sure.
Drawing your own care map is easy. We're going to show you how to do it using information that you already know. So grab a pencil, paper, and an eraser. Using symbols to represent people, first you'll draw the people and pets that live with you. Then you'll add any other people you care for. Add other people who are also caring for the people you care for. Add those who care for or support you. You will draw arrows to show who cares for whom, using different types of arrows to show how often that caring happens. Finally, you'll add a couple of lines to indicate who lives close by and who lives really far away. Still need help? Get our how-to document to get written step-by-step instructions and a handy template. Watch our third video that shows how you can learn and act upon your care map.
Great. So hopefully that was helpful for some people. So I'm going to share back the slide deck so we can start building our care map. Okay.
All right. So if you have your paper in front of you, if you can start by drawing yourself at the center of the page and adding the people that live with you beside them, and then you can draw a house around them. Then you can add anyone you care for to the map, including any pets. Add anyone who also cares for the people you care for. And then you can add the people that support you, no matter how little or small that might be. And once you have those main people down, you can start drawing the arrows to show the relationships between the people in your map. So use different types of arrows. So it's representing the type of care that takes place. So for instance, if you have someone in your home, you might make that arrow a little thicker just to show that person is a more of a commitment. But feel free, if you don't like doing the different dotted lines or whatever, you can also use different colors instead, or different lines, and just make sure that you keep a legend so that you can remember which the different lines mean. So lastly, add all to the map, all the healthcare professionals who care for you and the care recipient, and you can use a triangle to represent them. So now you have about 10 minutes to start drawing this by hand. And you've got the 2 documents that you mentioned. And if there's any questions, you can put them into the chat as well as you're doing that.
Great. So as Cynthia mentioned, we're going to give everybody 10 minutes. Just to sort of mention the building, CareMap building questions, that document, you're just going to work with that first section. You'll be using the second section in a few minutes. So we'll give you some time. Okay, guys, I think we'll start to come back together. That's been about 10 minutes because you'll be interacting with your map in just a few minutes again. So I'm just going to move us along because I had skipped back due to a request in chat. Okay, Cynthia, back over to you. Oh, you're on mute, Cynthia.
So now that you've made your care map, we can go through and with some questions to help you reflect and revise it. And the purpose of this is to see where you might have forgotten people or activities that might be important. It will also highlight opportunities for additional support from people in services already on your care map or not on it yet. So when reflecting on your care map, you will have the option to add any tasks or activities that, if supported, would be helpful. For example, help with walking the dog, tending to the flower gardens, anything that's important to you that needs to keep going, but you could use some help with. So find some space on your map and write the words wish list. This list is where you can capture any additional tasks or activities from the review questions. So when sharing your care map with family, friends, or healthcare professionals, you can show them your wish list, and showing them the wish list allows them to offer help for things that are on there, or they can give you suggestions of who might help with that in the community as well. So having the list, it removes some of the tension where you're asking for or offering help or having that conversation. It gets it started. So the person will identify what they can help with, or maybe suggest someone that could help you with one of those tasks. So please look at the care map building questions document on the second page. And again, if you don't have that open, it's in the chat box. So it has questions that will help you reflect on your map. And these questions will help you see if you've missed people or services, and highlights any additional support needed. So remember, if you have new tasks or activities that you'd like to like support with, place them there or put them onto your wish list. Have the question document visible while you're revisiting your care map, and take a few moments just to review the questions and add them to your map if needed. So we're going to take about 10 minutes to do this exercise. Just reflect on your map and see that you've got everything included that should be there.
Great. So here's your opportunity, as Cynthia mentioned, to take a sort of second pass at that map and use the other section of the building questions document to help guide you, and write your wish list so that if there's anything that pops into your mind where you think I could really, use some support with this task, then add it to your wish list. So 10 minutes is over to you guys. Okay, everybody, I think we'll start to come back together so we can move on to the next sections of the workshop. I know it's a process creating your map. Cynthia and I were talking about that just before the workshop. So, you've got yourself started, which is great, and you will continue to update that map. It makes me think about the idea of it's a living document. You're consistently adjusting it, especially as health outcomes change over the trajectory. So let's continue along. All right, so now that we've created our map, let's look at how we can use it. I like to think of it as how we can put this map to work. So engaging your community is, oh, did I move past? Nope, good. So engaging your community is how you can add some support to your care map. We've included the following guides in your welcome package. So you did get a bunch of stuff from us. And one of the documents is care maps, sharing with your family and friends. And then there's another one about sharing with your healthcare professional. So those are sort of two guides that are going to help you with that piece. You can also access copies on PIME's website using the link on your care map fact sheet document, where there's a ton of resources related to this tool. So let's have a talk about how and why to share your care map with family and friends, and then let's focus specifically on healthcare professionals. So here are some easy steps for sharing your care map. So step one, be prepared to explain the purpose of a care map and why you created one. Again, a lot of this stuff is in the guides that we provided you with. By attending this workshop, you gain that knowledge, and it'll help you better explain the purpose and the benefit of using an Atlas CareMap. Step two, prepare a list of questions you want to ask the healthcare professional. You could ask for recommendations and where they may see other resources benefiting your care. So for instance, if you have that wish list, they could see that wish list and may suggest some community organizations that they're aware of that could help out with that wish list. Bring your care map with you to all your appointments. Continuously reviewing the care map allows a healthcare professional to monitor the situation. Share your care map with the healthcare professional will allow them to see your support network and your wish list. This way, they can help connect you with resources and services to address some of the things on the wish list. By better understanding what is important to you, they can provide you with the appropriate medical care. So you could take a photo of it, or you have it on your phone, or you could carry a copy in your purse when you're going to appointments and things like that, to be able to show them the care map. So PIME has developed a healthcare module specifically to increase the awareness of the CareMap program, this tool, and how to use it in their practice to better support patients. The module can be accessed on PIME's website. So, if you find that they're really interested, you could always encourage them to check out the free module. Now that we know the benefits of sharing our map, we can now look at how to increase your support and broaden your support network, which is the other piece around the map. The wish list you placed on your map during the reflection activity was designed specifically to help with this. You can use the wish list to ask for support or ideas on where to look for support to address what is on there. And you can ask family, friends, or even your healthcare professionals. You can also share your wish list with people who offer help. So, you know, maybe you have a neighbor who says, if you ever need anything, just let me know. Show them your wish list. By sharing the wish list, you remove that barrier to talk about, you know, asking for help. And so it makes it an easier conversation often. And it allows them to just simply look at that list and go, I can do that. I can tend to the garden. That's easy. I will take care of that. So let's explore some conversation tips that might help with potential barriers that can come up when engaging with the map. So basically when you're either creating a map or helping someone create the map, or you're sharing the map. The first potential barrier would be when a caregiver is sharing their map. When showing the wish list, explore what it is and what you are hoping people around you can help out with. You may get a response along the lines of, sorry, but I can't help out with this. If so, thank them for being honest with you. You never know what is going on in someone's life. The next potential barrier would be if you are helping create a care map with someone, a caregiver, and they express they have no connections to help out with the wish list. We know that there are Canadians who are isolated, and it can be for a variety of reasons. However, sometimes helping them think about the place that they visit and the people that they regularly engage with can highlight potential connections that they just may not have initially thought about or didn't see as a connection for support. In this situation, it becomes even more important to explore community supports that can help the caregiver. And so just a quick little example might be, you know, if they're working, right? And maybe they're quite close with some of their colleagues. So who's to say that their colleagues couldn't play a supportive role with something? Okay, so on to the next and last sort of activity portion of the workshop. And so here, what we're going to do is we're going to put you into breakout rooms with another person, and we're just going to give you guys an opportunity to sort of start talking about your care map. So you're sharing your care map. We wanted to give a little bit of time to this because we realize it can be a bit nerve-wracking. And so, you know, that's why we thought just breaking us into groups of 2, just to sort of a bit of a test run. So you would have received a document called the discussion activity, and it's just a 1-pager, and there's 2 sections to that document. So it was in your welcome package, but it has also just been placed in the chat. What we want you to do is basically have a look at the document when you guys get into the room, decide who's going to share their map first. And so quickly you can see which role you're going to be looking at within the document. And then we'll give you a little cue about halfway through to switch. You guys will have about 15 minutes for this activity. And I just sort of want to mention, because we drew our maps by hand and we're doing this virtually, you're going to have to hold your map up in front of the camera. And you would have heard me say earlier that if you had any sort of background on, it would become a problem because basically the map disappears. So if you have a background on and you could turn it off, that would be great. If you need help, put that in the chat and the ladies can help you out. Yeah. I think that's everything. If there's any questions, again, post in the chat. If something happens and maybe your partner drops out of the chat for some reason, again, just post that in the chat and we will either bring you back into the main room or maybe you'll get myself or Cynthia to be your partner on this activity. Okay, so I think we're going to break out into our rooms. So I think we're all back in the main room now. if anybody wants to throw into the chat, maybe some of the key takeaways around sharing your map with someone else, that would be great. Like, we'd love to see some of your initial thoughts around the map and sharing it, because we know that that can be a challenge. Does anybody have some initial feedback and thoughts?
In doing the care map, I think one of the things that came up was how it's kind of helpful that allows you to see sort of a bigger picture. So you're not necessarily, focused on one particular area, but you can see like multiple supports and also where the gaps are, but sort of seeing it all written down and being able to look at it, it's sort of could be a little bit less overwhelming to see it written down. And then you can sort of think, well, what am I going to do with these particular gaps?
Awesome. Yeah. We were, so I attended one of the breakout rooms. And so we were sort of talking about that, and also just sort of the mental health piece, right? That can come from having the map, being able to reference it, look at it, share it, that sort of stuff. So great. Thank you for sharing.
I'll comment. I actually was paired with Lisa, which is ironic because we're former colleagues. And so coming also from working in palliative care, I think one of the things that we both sort of queried at first too is like the readiness and the energy for a caregiver at that very active caregiving time versus someone who maybe has a loved one who has more of a longer term chronic, like more earlier upstream. But really what kind of stood out to me and what I was saying to Lisa, my intention is that I'm caregiving in a very light way right now to an 83-year-old mom. So my intention is I've taken my map, but I can see it being actually a really useful tool to actually develop with someone. So when I think about a hospice context, I think this is a great tool for building a relationship between a volunteer and a caregiver. But I also see for family, it's a great way to start the conversation that sometimes families, you don't always know. So when it was asking about, identifying who are the other supports to that person that you're caring for, you might not always know if you don't live in the home or if you're not that curious about it. So I thought that was actually, one of the valuable pieces, that it's a great way early on just to start a conversation and have a visual, like it gives an activity that kind of helps drive it. So you're not kind of wondering or fumbling around as to like, okay, why are we having this conversation? My mother would be like, are you planning to do something?
These are all really great points. And the research that was done by Atlas of Caregiving highlights all of that, right? How it actually helped caregivers often realize how much support they did have, help them share their journey easier with their family and friends. So that's really interesting to hear. And that's certainly what the research work that went into creating this tool. It says the same thing. Just quickly in the chat, a couple of people said they really love the wish list idea around, thinking it will help people offer and accept help easier. And honestly, like that is our point. We know that is a big barrier. So I'm really glad to hear that piece. Another person pointed out drawing their map really showed them how much support was out there. So that's great, right? Because sometimes we do sort of, we've got a lot on our plate and we just get very focused and we don't necessarily realize all of that potential. And so putting it on the map can help. And that's the idea. It may re-engage a broader support network. Okay, we're going to move on because I really want to get into the sort of the last section, and then hopefully we'll have a few minutes for questions. So we may go over time-wise, and if you can stay on, great. If you can't, just a reminder, there will be a recording that you'll receive. Okay, so moving on to the next section. So where to look for additional support. So we thought we would just take a few minutes to explore that. So here's a quick list of community resources that can help someone with the tasks or activities not currently supported on their care map. So maybe their wish list, for instance. Within the last few years, there has been an increase in the number of online platforms where you can offer or ask for help, such as Facebook neighborhoods. So I have many of these. I have a Facebook street, which we offer help, and people will post if they need it. a neighborhood app. I'm not sure if anybody has seen that yet, but I also have that app and we often do the same thing there. So take a look around online to see if there are any of these in your area. PALIUM has also created an extensive list of community resources. So if you go on to our website, which is in that CareMap, how to create your CareMap guide document, you can see the toolkit, which is focused, it's like, I think 6 or 8 documents, and it's focused solely on creating that CareMap. And in there will be a document that lists resources. So just to sort of quickly recap what's on the slide, obviously, find out about the hospices around you, because, they often have programming long before you may need residential support. 211, it's across Canada, 211.ca, would encourage you to look there. You can also call in, it's in 150 different languages, so it's a really great support. Look around for your community database. You usually have a local one. Look to see if there's any regional caregiving organizations or associations. We will cover those in a few minutes. Go to the library. Often they will know about great resources in the community, and then also mental health associations. So here's another research finding that supports the need to support caregivers. So 1 in 5 caregivers have said that they do feel that their physical and mental health suffered as a result of their caregiving responsibilities. It may not have been the whole time, but at some point. The decline in health can happen when they are not getting time for self-care and are basically spread too thin, and that, because of all the stuff that they're trying to look after or maybe manage. So with 25% of the Canadian population currently taking on a caregiving role, there's a need to support them. And then, as I mentioned, we pulled together a document about the national organization or the caregiving organizations. And I just quickly want to mention this landscape is changing quite regularly, because I think certainly in Canada, caregivers, or the conversation about supporting caregivers, is becoming a lot stronger. And so, there may be some in your province that aren't currently listed here. So Google it, reach out to 211 and see if there's anything there. We just wanted to share 2 interesting initiatives that the Atlas CareMap and the Care Connection program sort of align with. And I know there's some organizations on here as well as healthcare professionals. So we just thought we would highlight these with you. So first is the Frome model. So the city of Frome is a fitting example of a CareMap's benefits and the community's role in providing care. The city took a community healthcare approach, the patient's care planning centered around what the person enjoys doing when they are healthy, and how they can continue doing that when they're not healthy. So instead of relying on medications for relief, they were encouraged to attend support groups, talking cafes, engage with volunteers and let them help with small tasks. And basically the pilot, and so this was a pilot research project, it showed a reduction in the residents' feeling of being isolated, feeling of loneliness, and therefore improving their health. And they actually saw a very large reduction in emergency room visits because people were better supported, and so often reached out to that support network first before going to the emergency department. Then there's the Help Project, so the Healthy End of Life Project, and it's actually out of Australia, but we are doing a pilot version here in Canada, in Ottawa, actually. And so this project aims to challenge the social norms around asking for and accepting help. Challenging the social norms around death, dying, and grief creates a community where individuals feel supported. So if you're interested in either one of these programs, just Google them. You can find them quite easily. I know Help Ottawa has a webpage, and then for sure the Frome model as well. Okay, closing remarks. So now that we've created and explored how to share a map, we want to take a few minutes to talk about some ideas regarding how you can get involved in increasing the awareness and the use of the map. This is a newer program here in Canada, and therefore we need your help. Let's look at the healthcare role first. So this includes doctors, nurses, pharmacists, PSWs, social workers, and more. If you are looking after the health of a caregiver, this slide's for you. You can make them aware of the tool, for instance, support them while creating the map, and then integrate the map into their care plan, their health plan, right? So revisiting it when you're meeting with them again. You can also help increase the awareness within your community by hosting the workshops with the free toolkit. So again, on Pallium's website, there's actually an Atlas CareMap community toolkit that has everything in it, and this slide deck is in that toolkit. So by hosting these community workshops, you'll help increase that awareness. And also we want to encourage you to partner up, right? So partner up with a hospice, a library, a health center, maybe it's a faith community. You really don't need to do it on your own. So look around, I'm sure there will be others who want to help participate. Now let's explore ideas for anyone here today who is a part of an organization, which is pretty much most of us, myself included. So your organization can share the CareMap fact sheet within the organization, and you could also share it with partners that you work with and engage with on a regular basis. The idea being there could be employees within your organization who are caregiving. They may not be known. Same thing for your partners. Organizations, they could have employees who are caregiving. And so therefore, that's why we encourage you to share it. Also, your partners, organizations, they may serve this target audience. So increasing their awareness of the tool could be really great. And you can also host a workshop yourself using that toolkit. And again, don't be afraid to partner up with other people. And last but not least, because individuals can be very powerful champions, you as an individual can help increase the awareness of the use of the tool. You can help people around you create their map, which I know as a caregiver, creating your map, it could be just a bit too much. So having someone do it for you and you just answer questions is probably a lot more realistic. You could also host a workshop, obviously, in the community. So that's another great way to increase the awareness and the use of the care maps. And also you can spread the word. So, you can post about it on your social media, share it with your volunteer groups, share it with any organizations you interact with on a regular basis. Use that fact sheet that, that's your sales document, so to speak. So remember, there are caregivers all around us where we work, our neighborhoods, faith communities, and more. They often go unnoticed for many reasons. So spread the word, get the tool in front of them. You can increase the awareness and the use of the tool, ultimately increasing their connections and their support network. So as mentioned, this is a newer program, so we're hoping that you can help us increase that awareness. So now let's just do a quick review of what we learned today regarding the creation and the use of a CareMap tool. We saw that creating and sharing the CareMap will help the caregiver, family, friends, and healthcare professional better understand that current caregiving experience. By reflecting and sharing the map, the caregivers feel more supported. Sharing the CareMaps will enable conversations around care experience, asking for and offering help with that wish list. This will lead to caregivers and care recipients having a broader support network, improving their quality of life while they're on this journey. By coming to this workshop, you are not only learning about the CareMap tool, but you are also expanding your network of support. For the caregivers at the workshop, you have received your CareMap, or you have created your CareMap and have the tools to start using it to improve your care experience. For the community member who wants to support caregivers around you, you have the tools to help you create and use the map. So we're coming to an end. Just before I we end the workshop, are there any questions about the workshop, the tools, or anything that you guys may be still wondering about? If you wanted to just maybe unmute and we can take a couple of questions. Again, I think we're probably getting close to our time, so we can run a few minutes over. If you have to leave, you will get the recording. So just while I'm waiting to see if anybody unmutes, I'll just mention there really are a lot of other resources on Pallium's website, specifically around the community and supporting caregivers. So check out the other Atlas toolkits that are free for download. And there's some other community resources for people in faith communities, workplaces. So please, I encourage you to visit the website. All right, so does anybody have any questions? Or maybe anything else that they want to share, or do you have an idea on how you're going to promote the awareness of this tool? So if you want to unmute yourself, please do.
Just sort of very high level curiosity. What is the hope that Pallium has in terms of the spread and the reach for this? I know you've been doing these workshops and the encouragement to have organizations start to host these types of workshop sessions. But I'm just curious, like, is there sort of an aim? Because this is over a couple of years. I think you said 5.
So the ECHO project, who is supporting this webinar today, which is another Pallium resource ultimately, but the CareMaps itself, we don't, we want it to spread across the country. That is basically our goal. We're talking to anybody that we can think of who would see benefit from the CareMap program, but ultimately, as the overarching programs called Care Connections, that's our goal. Like, we really want to increase those care connections, and we really wanted another wish, or our goal for this program is to maybe start to make that healthcare connection a little stronger, right? So when you're having a conversation with your family doctor, or maybe that nurse practitioner, the conversation isn't just about medical symptoms and things like that. We're hoping it'll start to transition into, how's your support network? Are you seeing your friends? Starting to have that conversation. And I know the person I was partnered up with during the activity, we both sort of talked about sometimes, those medical visits can be very medicalized. So that's one of our hopes of the Atlas CareMap in that Care Connections program.
Great. Likewise, I think we said the same thing in our breakout group, just the value of it, being able to inform your healthcare providers to be conscientious of the supports you have, but also the burden or just the demands on the caregiving family member. Great.
Yeah, absolutely. And that's why we've also included that healthcare module, right? So that we can talk about this content and how they can integrate it into their practice, everyday practice. So yeah. Someone has so Norma, you have your hand up, I hear. Can you unmute yourself, Norma?
I thought I had.
Ah, there you are.
Hi. So do you feel that the CareMap is complementary to the advanced care planning?
I don't see why not.
I think it has some similar information, but I think it's obviously more focused on the care. It's just,
Yeah.
It seems like it's complementary.
Absolutely. And you're right. I mean, if you have an advanced care plan and you've made a care map, like, could you not share that care map, with your substitute decision maker, right? Just the more people around you are informed, the better the journey is going to be, right? For the caregiver and the care recipient. And ultimately, that's what it's about, is about sort of best quality of life as possible while on that journey. So I'm sure that it absolutely can.
Yeah.
I see Jen has raised her hand. So Jen, did you want to unmute yourself?
Hi, everybody. I'm Jen from Ottawa. I'm one of the site facilitators with the HELP project that you made reference to earlier. So really appreciate this information, and we'll probably be using it within our sites, one of our 4 sites. So thank you for that. It was very helpful. I wrote it in the chat. I just thought I would speak to it. I was surprised at just what a different lens it is doing this from the caregiver lens. Supporting caregivers is one of our target areas with the HELP project, but I think there's often so much focus on the person that needs the care, and you could see developing a care map for the person who needs the care, and it's sort of a shift it's a real shift in thinking around that we need to provide that kind of support for the caregiver as well, and that there's parallel and or conflicting needs between the caregiver and the person who needs care. And anyways, I was surprised in doing it personally how that sort of brought up a bit of conflict. I kept wanting to put the person in my life who needs care in the middle. And I thought, oh, that's interesting, even with all the work I'm doing and all the reading I'm doing and all of our initiatives, that I still in that moment had that reaction. Anyways, I just thought I would share that.
Thank you for sharing. Yeah, it becomes ingrained in you. I'll just share sort of super quick. I was a caregiver for a long time, and I got exposed to the Atlas CareMap tool when it was in its research stage. And my neighborhood ended up stepping in to really help me and my late partner. And so figuring out what I sort of needed help with, they would all just basically come in and sign their name next to those things on the so-called wish list. So you're absolutely correct. Like it helps you see your journey a bit more. And it's a hard thing because sometimes it's been a long time that you've been caregiving. You get ingrained in focusing on the other person and never focusing on yourself. But, we're hearing a lot more now these days around it's important for self-care, and it truly is. And this is probably almost, your step to starting self-care maybe. Does anybody else have any? Shane, go ahead.
I just think that's such a valuable point, given that carer burnout is one of the main reasons for admission. If carers were more supported. And I presume Canada is similar to Australia in our resources are limited, and we've got, a lot of a silver tsunami really of people who are becoming frail and aging. So it's just sort of a no-brainer in a way that carers need that sort of support and has so many benefits.
Yeah, absolutely. And I really think, and this is sort of why the last couple slides were added in. We've been having conversations. So there's another workshop coming up next week with, we're co-hosting it with the Dorothy Lay Hospice. And I think we've got a few people on here from the hospice. And so the group of us have been sort of chatting about, that action piece, right? And so that's really why with the individual one, it's, if you can help those caregivers drive, right? Because you can just be in such a fog and so tired. And as Jen mentioned, you're just not thinking about yourself. So if you can sort of do that, the heavy load, and they just answer the questions, I think that can be very helpful and increase the chances that caregivers are gonna engage with this tool. Because if they were to pick it up on their own, they could be just too tired at that time to do it, right? So that's why we're sort of saying anybody can get involved. Any other feedback or questions that you want to ask? All right, I don't think there's any more, and I don't see anything else coming into the chat. Thank you guys for joining us. We've been working pretty hard at this, Cynthia and I, as well as we've been meeting quite a bit, the Dorothy Lay Hospice. And so thank you very much for joining us. We hope you enjoyed the workshop and your initial drawing of the care map. As mentioned, please fill out that survey because that's going to give us really great feedback. And there is another workshop coming up next week. I think it's on the 29th. And anybody correct me if I'm wrong. And hopefully you can help increase the awareness and the use of the tool. check out our site. We've got a lot of other stuff to sort of help caregivers in the community. Thank you for joining us tonight.